Hello, my name is Francisco, and I will be showing you guys through this video my project for Engineering Design 230 class. And so let's get started. For the project, what we had to do is that we had to find a scholarly article from the Winter Simulation Conference and make a model in the Simio program for it so people could better understand it and use it as a visual reference. And so here is the document that I found. The title is Reducing Time in an Emergency Room via a Fast Track. And here are the industrial engineers. And these are the management people from Mercy Hospital, which is located in Florida. So in the introduction, it says, well, we can point out real quickly that they base their priorities on the patient's sickness level. So it says a patient with an open wound has a higher priority over a patient with a vesicular bladder pain. So obviously here we can input that they will take care faster for the people who are in a critical condition than the people who are in a less critical condition. And so Mercy Hospital has set them in types of groups patients, and they have 4 types of patients. In the first group, it's type 0 and 1 patients, which are critical, and this is the more serious conditions. And the second group, which is type 2, 3, 4, are less critical, like headaches, abrasions, wound checks. And here, for example, here you have the one with like cardiac open wounds. That would be a critical condition for the patient. And so the third type of patient would be the patient that comes through the ambulance, which is a big critical condition as well. It's emergency. So, and then the fourth type of patient is the one like a normal person who comes in car and then checks up. That would be similar to the type of patient 234. And so through this article, it tells us how each patient is sequentially put through the hospital and how effective it would be if they have each different sequences to go through so that the business can handle them easier and smoothly, and the transition between checking in to getting checked up to getting tested and to being sent out or operated on if needed, it would go smoothly. And we're putting the customer before us, so we want them to come in, receive good attention, and get out there quickly as possible because we don't want to waste their time, nor the Mercy Hospitals wants to waste their time. So here are the 4 categories as assigned, and it's over here in this paragraph right here. And as we go further down, here we see a model in figure 1 flow of patients, and as you see, they first go to registration clerk, and then triage area, and then in this area, equity of illness, they test to see if you're critical or non-critical, less critical. And so as you see on the critical line, type 0 and 1 enter directly into ER bed area, and then after being attended, they get tested, and whether or not they're good, they will be treated and sent home, or if they're bad, they'll be sent to the emergency treatment floor. And as for the non so critical, type 2, 3, 4, they will be in the waiting area, and then they will check if there's a bed available, and if there's not, they will re-enter the waiting area. And then go into the ER bed until there are beds open with a yes, and then they will follow the same procedure. And then here are for the patients who come through the ambulance, which obviously is a big emergency. They will go directly into the ER bed area, paralleling with the registration clerk. So that would be kind of like the same time. And so patients coming with the car, they would follow as well as the non so critical patients. And so they would come through the process of registration, triage area, and then the equity of illness. And then they would be similar to the non-critical. They would come down and go to the waiting area as well and follow the same procedures as it would be, and then the same in the ER bed area. And so looking at this and seeing how they modeled it and the flow, the sequence of each patient, each type of patient, I was able to go into Simio, which I'm about to do now, and basically remake the model in Simio and add some features to it to make it more observable, more so it could stay in your mind, because more if it's more visual, it helps more sometimes. So here's the design that I made, and with this I will run it and show you guys how everything works out. And so here you have your patients in each entrance they will enter, and then they will follow their sequence in the Simio model simulation. And here in the tables, you can see that here are their sequences each. The patient 01, as I told you earlier, this is their sequence for patient 234. Here's their sequence. For the patients that come through ambulance, here are their sequence. As you notice, they're much shorter because they go directly into the ER bed area. And for the car patients, is very similar to the patient 234. And so from these sequences, I'm able to run this model simulation and see each one go through where they're supposed to be. And through having no network space, each one can follow their sequence without having connectors or paths or time paths. And they will enter and then exit as if it were in real life, to enter into a hospital and get checked up on, and then leave if everything's fine, or go into emergency if everything is not okay. So here I will run my simulation. And as you see, each one is going through their sequence, and as the majority of patient 01 and ambulance patients enter and leave through the emergency and sent to the floor, and the patients who come in car, and usually patients 234 come in, are checked up, and most of them are sent back home because they're not as much in a critical condition as the more critical patients that come through ambulance and 01. So from this, I will fast forward it. And as you can see, after the model has finished, there's still patients waiting in the waiting area, in the triage center and registration clerk. So after the simulation is done, I guess we'll stop it and see the results. And here are the results. And as you can see, here's the average amount of patients from ambulance that come, maximum, how much time I spent in there. And then the same goes for the car patient and how much time they're spent in there. For critical condition patients, not as much as the patient category 234. And then this is how much time it takes to process them through each service. And so through this simulation model, we can find out how we can make businesses more efficient and work better, and to serve the customer more properly, so we will get good results. And this is the simulation model viewed in 3D. Here I'll take out the label so you can see it more clearly. And as you can see, there are your 4 doors. There's your 4 type of patients, and then the desk, waiting area, the ER bed area, and the 2 doors where they either go home or leave into the emergency room for further action. And so this is the model right here in 3D. Now I guess I'll put it back into 2D, and there you go. And this is the model for the article that I found in the Winter Simulation Conference. And this is all the sequences again. And through this you can do many things. It'll help a lot with businesses, flow production, see time and system, and how you can make your business more efficient without wasting time and putting the customer as a high priority and serving them well without any slowing down and with better flow. Thank you for watching.